When our children aren't feeling well, we feel their pain right along with them.
That's right. I know you have little ones, so it becomes even more of a challenge. I know some common problems the little ones may develop involve digestive issues, but how do you know if your child's problems are what you would consider normal and when you should seek the advice of a specialist?
It's hard on parents sometimes, and today we have some answers with Dr. Deborah Cloney, the Section Chief of Pediatric Gastroenterology at Helen DeVos Children's Hospital, who can answer some of those questions. I think it's sometimes tough because when your kids are really little, maybe even babies, they really can't communicate what's wrong with them.
That's very true.
And so what does a pediatric gastroenterologist do?
We take care of any kind of problem with the digestive system, from the stomach, intestines, pancreas, liver. We see many different types of problems. Abdominal pain is very common for us, inflammatory bowel disease, liver disease, gastroesophageal reflux. But one of the most common things we see is constipation.
Really? Constipation, you'd think that that seems like it should be something that kids don't have to struggle with, but
oh, they struggle with
quite the opposite.
it. Oh, they struggle with it quite a bit. Probably about 3% of visits to primary care physician's office are caused by constipation, and about 25% of new patient referrals to gastroenterologists are for constipation problems. So we see it every day.
Okay, so what causes constipation in children the most?
There are many different factors. Diet can be a big one. Too much dairy, too much starchy foods, not enough water and fiber. Toilet training is a big one. Sometimes if children are toilet trained when they aren't quite ready for it, they become resistant to having bowel movements. Sometimes little things, travel can start a constipation problem. Once a child has a painful bowel movement, though, they remember it, and that can start the cycle.
Okay, so let's talk about the dietary specifics. What about fiber? How much fiber should we give to our kids? And are we talking about having them eat things like grape nuts or some kind of cereal?
There are a lot of different choices of fiber out there. If you want to look for an estimate of how to gauge how much fiber your child should be eating, you want to take their age in years and add 5 to 10 grams. That'll give you an estimate. That works up until the child gets to be about age 18, and then we're talking the adult dietary intake, which is roughly 30 grams a day.
So Dr. Cloney, do you think that we should be striving to add it, or do you feel that if a child or a person has a regular diet, is eating all the food groups and trying to do what we're supposed to do, we are getting enough?
Ideally, it should be in your day-to-day diet, but in our society, sometimes it's hard to get in enough fiber, so I think it's helpful for parents to learn how to read the labels. If a label says it has 3 grams fiber per serving, that's a pretty good amount.
Okay.
What about for nursing mothers? Is there something that nursing moms should be doing? I know that the focus really has been nursing for at least the first year. Many women nurse beyond that. Are there any special guidelines you give to nursing mothers?
Well, nursing mothers have the benefit for their children that breast milk tends to naturally make the stools loose. So usually when a child's diet is mainly breast milk, they're stooling well. They rarely need anything additional. But once they start weaning from the breast milk, they're going to have to concentrate on fiber and their solid foods just like all the other kids.
Okay. Let's talk about fluid intake, because you had mentioned that also with the diet. Really important. We know that kids should be drinking certain things, and probably drinking a certain amount of it too.
Oh, exactly. And if you eat a lot of fiber and you don't drink enough fluid, the fiber's not going to work for you. So making sure enough fluid's getting in the diet is very important. My mama always used to say 8 cups a day of water, and she was pretty on target for your average school-age kid.
Know best,
that's about what you want. But there is a range that you can look at that will help you based on your child's weight to get in enough fluid. Water's always best. We don't want kids drinking too much juice, and of course we don't want them drinking too much milk because that can cause constipation.
Okay, so how do you know if your child is constipated, especially when your child may be too young to actually have those words to be able to express it to you?
That's a big word too.
Yeah, exactly. Yeah.
Sometimes it can be obvious. I mean, sometimes a parent can look at the stool and say, that is not right, it is too large, it is too hard, my child had pain with that bowel movement. There might even be bleeding with the bowel movement. Sometimes it's subtle though. Sometimes a child might just have some abdominal distension, a bloated belly. They might just not feel good. Their appetite might drop off a little bit. And one of the most puzzling things for parents is when soiling starts. If a child becomes quite constipated, they'll start having leakage of stool.
Oh, okay.
It can almost look like diarrhea sometimes.
Okay, that's all been good information. And so can people contact you if they have more information or they fear there might be a bigger or more serious problem?
Of course. It's always good to start with your primary care physician. They know your child. They'll help you determine what the next step of action would be. But we're always available to see children with GI problems.
Yeah, great information. Thank you so much for joining us today.
Thank you for having me. I appreciate it.
There's more 8 West to come, so don't go away.